Hi class, this video is to cover the PowerPoint Public Health and Social Work. This is Dr. Janine Cross. I will be your instructor for Social Work and Healthcare 1, and this is one of the video PowerPoints that we are covering for this week's content and reading. What are the public health functions? Again, what are the functions of public health? There are a few functions for public health, and they are listed here. Assessment, policy, and assurance, excuse me. One of the functions of public health is assessment, and that the key goal is to make sure that public health uses diagnosing as well as collecting of health information to make population health information available. So understanding the problems that occur with society related to healthcare diagnosing, understanding what is going on in terms of um, health risks, exposure, infections, rates, etc., exposure, sickness, um, and making sure that we have that valuable data to help make information that best serves the overall population health. So assessment, again, think about COVID-19, think about other types of pandemic, Ebola and H1N1. One of the key functions is to understand what it is that is going on when people become ill or start having adverse effects related to healthcare. So diagnosing and understanding what's going on in terms of specific diseases. As we know now, we are dealing with COVID-19, but prior to that, we didn't know what it was. We know that there was an illness that globally crossed over into the United States and was killing many people and affecting many people. But then our public health functions had to identify and diagnose it as COVID-19, as a virus um, um, that was transmitted from overseas over to the United States. And then, if you notice that one of our key public health functions, specifically related to COVID-19, was collecting health information, understanding more about exposure, who's vulnerable, who's at risk, rates, deaths, and so forth, treatments. So again, collecting information and making it available to the public. Um, there's some controversy in how well our public health assessment functioned during COVID-19, and that could be a larger conversation. But that's just to give you an example that at least where we are today, we are doing better assessment of diagnosing people when they're infected, our rates, and we're also doing a better job than when it first became a declared as a public health pandemic in the U.S. We're doing better at collecting health information, sharing that information, and helping people stay healthy and protected. Another key function of public health is policy development, use of information to develop a strategic approach to improve a community's health. Some of the policy developments that you've seen specifically related to COVID-19, and as we are dealing with the pandemic, it really gives us a good opportunity to understand these key concepts directly related uh, to, and it gives us actually a public health pandemic in which to understand and discuss more of these concepts. But we saw a lot of policy development. Think about how a lot of states decided to address COVID-19. Some by requiring masks, some not. Some outlining recommendations related to school, how public school will commence in this year, how higher education would. A lot of states you see are implementing phased strategy or strategic approaches where phase one, phase two, phase three. And they're using the assessment function and the collection of health information to decide whether states are moving into phase one, phase two, they're holding at phase one or not. And so we use that policy information, or we use that health information to develop policies, and we see this. We always don't agree with the strategic approach that's developed, but all in the same, we should be using that public health information to help inform policies that we develop. Assurance, availability of health services and access to those resources. So when we understand from an assessment point, when we collect the health information and we have a good diagnostic understanding of what is going on in terms of public health, and then we're able to then use that information to develop the policies. Now we can also understand what services are available or is needed for people from a public health standpoint. So one way to think about it is think about the testing sites that we have for the drive-through testing sites, those availability of health services, testing kits for people, maybe funneling money toward vaccine research and tests. Those are examples of availability of health service and access to those resources. Again, um, a good example with access is the drive-through, and anybody being able to drive up and get a test done. So again, those are the functions of public health. This error or this poll message is coming up because this is usually a PowerPoint that I use with a poll, and so every time I get to a page with a poll, that's going to come up. I apologize. Epidemiology. What is epidemiology? It's basic public health science that studies epidemics. When we think of epidemiology, epidemiology is involved in interpreting new diseases, tracking sources of the disease, for the disease, and preventing the spread of existing disease. So part of it is understanding how epidemics are interpreted, particularly related to new diseases such as COVID-19. How do we track sources globally? Where did this come from? Where did this disease come from? We know now that there was some origins in China related to this, but it's still not clear um, how this disease became developed, or at least we're gathering more information about that, and preventing the spread of existing disease. And so once we understand new disease, we're able to interpret and understand and the source, at least how it is transmitted. We can then use that information to prevent the spread. Epidemiology is also the statistics used for quantifying data on epidemics and populations to measure sickness. The CDC does a good job of um, providing or publishing statistics on the number of people infected um, globally, in the United States, particularly, um, nationally, and by state. All that information is publicly available. And so, ep- un, when you understand epidemiology as a broader um, science, it does include how you're able to track, understand the statistics related to infection rates, and how the population is being infected and affected um, by an illness. Some of the data that we know specifically related to COVID-19 is we know that people who have vulnerable health conditions or pre-existing health conditions are more vulnerable. We know that older populations are more vulnerable and tend to get sick and have more morbid outcomes. Um, we also know we're learning more about other populations such as children and pregnant women. However, again, when we all that falls under the science of epidemiology. Biomedical science deals with the structure and behavior of living organisms. These concepts are key. You will not be asked in this course to discuss epidemiology, but we do talk about a lot of infections. We talk about sources of illness. We do talk a lot about population health, and understanding how epidemiology plays a role in that is key. Also, understanding in general how epidemiology fits into public health in general is also helpful when you're understanding more about different diseases and illness and how it impacts people. Biomedical science deals with the structure and behavior of living organisms. Also, biomedical research helps with understanding and controlling new diseases and epidemics. Environmental health tracks the spread of infectious organisms using epidemiology to track environmental causes. One of the things that we know with COVID 19 is it really took the scientific community by storm. And a lot of research and money was channeled into understanding the structure and behavior of the virus, particularly COVID 19. Also, a lot of research, a lot of efforts and initiative was put into research to help us understand COVID 19 more in terms of populations impacted, morbidity, mortality, and being able to control the spread of it and also hopefully contain it so that we don't see any evolution of new diseases either from it and so forth. We also need to be mindful too, because since we haven't went through a full annual cycle with COVID-19, I think we're still trying to get a good understanding on how to control it as we go through the different seasons. Um, March, it was considered a public health pandemic, even though it's believed that it had crossed over into the United States way early in March, maybe as early as January. But I say all that to say that we've when it was really identified and once it was ruled a public health pandemic, it was toward the middle of March, and that was the end of winter. So we haven't really seen it in a winter cycle. We've more seen it going through a spring and summer cycle. We are now going to see it upcoming in a fall cycle and a winter cycle. And I think that's going to really challenge researchers in understanding COVID-19 more. One, because it's going to be have to deal with that in the midst of cold and flu season. And so it makes you wonder about controlling COVID-19, which is considered a new disease, in the midst of other known diseases that tend to show themselves um, in fall and winter, such as, for example, flu or even RSV, which are both respiratory conditions that impact people. And again, environmental health tracks the spread of infectious organism using epidemiology to track environmental causes. So one of the things we would want to know is, what are the effects of COVID-19 when you consider other environmental factors such as climate, weather, season, and other type of environmental causes, because some regions have different environments. And so I'm sure a lot of scientists are working round the clock to try to understand from a geographic standpoint, for instance, in warmer climates, colder climates, northeast. Again, it's going to use the environment also to try to measure what the outcomes is of COVID-19 and how it impacts um, public health. So we have, when we think about prevention levels in public health, how do we prevent the spread of disease and illness? We look at it from three different preventions: primary prevention, secondary prevention, and tertiary prevention. Primary prevention protects us from injury and disease. Secondary prevention is early diagnosis and treatment of disease. And tertiary prevention is action taken to minimize the effects of a disease. So when you think about primary prevention to help protect us from injury and disease, those type of primary preventions that we see specifically with COVID-19 has been wearing a mask, washing your hands, and staying indoors. Making sure that we do not go out to potentially expose ourselves to the disease or to the virus. Secondary prevention, early diagnosis and treatment of the disease. So how that would look in the context of COVID-19 would be knowing the symptoms so that you can get an early diagnosis, knowing when you potentially have been exposed, and then going to get tested at potentially at one of the drive-in testing sites, and then being properly treated for the disease. Now, as we don't have a vaccine right now to treat, the treatment that we are utilizing or the intervention that we are applying to COVID-19 is quarantine. So when somebody has an early diagnosis of it, we're asking them to self-quarantine. You've also seen a lot of state policies in which they are requiring travelers when they come out of certain areas, especially um, areas that are considered epicenters or have large rates of infections, they're asked to quarantine because in those aspects they're presumed to have a diagnosis, a positive diagnosis, and the goal is to protect people from that. And so that's why that mandate, that policy to self quarantine was in place. Again, it was the way of certain states used to try to protect um, uh, um, residents in their states by requiring people to self quarantine to not spread the disease. Again, it wasn't known that people leaving epicenter was positive COVID, but it was presumed, and so that right now is the intervention and treatment that we're using. Tertiary prevention is actions taken to minimize the effects of a disease. Think about some of the policies um, um, that we have in place to try to minimize the effects of the spread. That's minimize the rate, but it's also to minimize um, um, adverse more, morbid outcomes related to an illness. So sometimes when people have a diagnosis of any illness, the goal is to minimize the spread, or and a good example with that would be somebody who potentially has cancer. As many of you may know, sometimes doctors will rate it in terms of stage 1, stage 2, and stage 3, depending on what stages of the disease you are. So sometimes if you get an early diagnosis and you're at stage 1 or stage 2, the goal is to try to keep you at stage, maintain you at that stage, and then try to cure you. Um, and if that makes sense, the goal is to not have you progress into stage 3 and or stage 4. And so think about when you think about tertiary prevention, it's the actions taken to minimize the effects of a disease, adverse outcomes, minimize the spread of the disease further. So think about these prevention levels when you're reading about the different public health issues and challenges that we have. What does primary prevention look when we're talking about obesity? What does primary prevention look like when we're talking about diabetes, high cholesterol, stroke? Similar with secondary prevention. What does early diagnosis look like when we're talking about cancer, when we're talking about diabetes, when we're talking about um, um, hypertension, and so forth? Similar with tertiary prevention. What are the actions that we take to minimize the spread of the disease once we know somebody has a diagnosis? There's a 5-step approach to intervention when we think about public health. One is defining the problem. Two, identify the risk factors. Develop community level interventions, implement intervention, monitor interventions for evaluations. So, for instance, when you think about COVID-19, that is one problem. But there are also other problems within the larger public health problem, right? Some of it is the spread of the disease. How do we quarantine? Is it an issue of rights, human rights? How do we manage um, people's behavior to reduce the spread? That's also a problem. Do you do it with education? Do you do it with policies? Do you do it with regulations and so forth? So when you're thinking about public health intervention, you got to understand what you're dealing with in terms of what the public health issue is. Then you have to find what are the issues that are driving the public health problem. What is contributing to the spread? What's minimizing the spread? Lack of a vaccine. And what are some of the things that we can do as a people, um, or a country, or a nation, or a government, to address those problems once we have them clearly defined. And again, understanding the risk factors specifically for COVID-19, we know that, having pre-existing health conditions poses you as a risk factor. We know that certain populations, age groups are risk factors. We also know that social gathering in large groups are a risk factor, and so forth. So understanding the risk factors involved in not only the spread, but the treatment as well, and the intervention. So you want to understand what the risk factors or barriers are for people getting tested. And again, we know one big risk problem that we have is, not having at this time a vaccine to address this issue. Also developing community level interventions. Community level interventions can mean different type of interventions that we use on a community level to help address the problem. I can tell you that there's two initiatives that we are doing at Howard University that are considered community level interventions. One is mental health awareness in COVID-19. And so we are doing trainings to agencies and or community organizations and agencies about how to um, manage mental health, and all that comes with the mental health challenges related to people being infected and or affected by COVID-19. Another community level intervention, that's a good example of what we're doing here at Howard University, is we have a virtual health ministry where we're collaborating with a bunch of churches in the DC area, four major churches, and we're doing calls to their members to educate them about COVID-19, make sure they have resources and support to help them either see if a member of the church has COVID-19, make sure they're educated about the signs, symptoms of COVID-19, ask them, find out if they're taking care of somebody who's been diagnosed with COVID-19, and also provide them with resources and referrals so that they can get diagnosed, assessed for it, perhaps proper education and intervention by public health providers. And that's an example of community level interventions. And again, implementing these interventions, part four, and monitoring interventions for evaluation. So developing community level interventions is usually the planning that goes involved. And the implementing the intervention is the actual carrying out of those interventions to try to keep people safe and healthy. And monitor interventions for evaluation. Interventions are great, but unless you're evaluating those interventions to see how well they are actually working, um, it's very important to do that because you want to make sure that you modify your intervention, maybe change your intervention, or to no longer continue with that intervention if it's not effective. I can tell you for the mental health awareness um, um, trainings that we're doing with agencies, we do an evaluation at the very end, to see how helpful it was, and whether people who take the training know more about mental health and are ready to help support people than when they originally started the training. Um, this is a reflective exercise that I'd like for you to do on your own, and again, it'll help you understand and engage better with the content this week, and understand what it is you're supposed to be learning this week related to public health and epidemiology. Consider the epidemiology of a public health problem and the biomedical science and research related to it. Again, since we're in the midst of COVID-19, I think that is a very good lens to use throughout the course this semester. So consider the epidemiology of COVID-19. Um, do some research on some of the biomedical science and research that we know about COVID-19. The National Institute of Health and the CDC are good sources for this information. Also, do some research on what are the related population health statistics for this problem. The CDC keeps a running track list of infections for DC and for plenty states. So understand nationally, it has national numbers and it has it by state. So go do some research and look at the population health statistics for COVID-19. Also consider the public health function for this issue. We talked about that at the beginning of this PowerPoint. Assessment, as well as policy development. And I want you to think about what are some of the assessment and diagnostics for it. What are some of the policy development that we've used for it as well. And if you remember, I will take you back to that slide. And assurance. Also think about some of the health services and access to those services. So think about assessment, policy development, and assurance. Those are the public health functions for COVID-19. And what are the intervention levels you can identify for the problem? So again, I want you to do some reflection work on what primary, secondary, and tertiary intervention levels look like for COVID-19. And also apply the five-step approach on your own. This will help you understand better public health function, epidemiology, and applying it to a real life situation and a real life pandemic that we're experiencing now. There is a connection, a strong connection between public health and social work. At the origin, the very start of social work, social workers have always had a hand in public health, okay? Our roots are indistinguishable from public health. Even as early as the immunization campaigns to prevent smallpox, social work involvement was always a part of the forefront. If you do some research, I would like you to take some time to look up the 1912 Children's Bureau Reduced Infant Mortality and Shepard-Towner Act. Infant mortality was a huge problem in 1912, and to a certain extent in some states it still remains a problem today. But the Shepard-Towner Act, more commonly known, the Promotion of the Welfare and Hygiene of Maternity and Infancy Act, also known as the Shepard-Towner Act, was federal funding that was supposed to be earmarked for maternity and child care. It was sponsored by a senator in Texas and a representative in Iowa. And a good example of this is that social work has always been at the forefront to help address any public health crisis, including its work with the social work's involvement with the Children's Bureau, specifically related to infant mortality, as well as which was a public health issue of that time, again, and still is today in some states, but also then moving forward to getting certain legislation passed, such as the Shepard-Towner Act, so that we can have the funding available to deal with infant mortality. Other examples of a history of social work and public health, or the role of social work, or the function of social work in public health. In 1860s, Harriet Tubman, though not a professional social worker, addressed housing and healthcare needs of displaced African Americans after the Civil War. But I like to use that as an example of a function or a task of social work, and how the role or the practice, if you will, of social work. Again, even though Harriet Tubman wasn't a professional social worker, the work that she had done post Civil War was definitely aligned with social work practice, and aligned with a lot of the values and traditions of social work. In early 1920s, social work pioneer Irene McCoy focused on education, fair employment, and housing programs and policies to address poverty and public health and mortality in Chicago. The irony is her focus, Irene McCoy Gaines' focus on education, employment, and housing programs are very similar on what we look at now when we talk about social determinants of health, particularly poverty and its effects on public health and population health, especially for people of color. Similarly, in 1912, social work pioneer Bertie Henrietta Haynes was head worker for the Wendell Phillips Settlement House. A lot of earlier social work pioneers in settlement houses knew that the terrible conditions in which many men and women and children, who at that time were required to work in factories and sweatshops, also had to deal with a lot of unsanitary conditions that also spread diseases such as tuberculosis and other diseases. They also knew that substandard living and unsafe conditions at work and at people's homes, particularly for people who are poor, were often a result of systemic situations. And so, a lot of times, if you look at our history of social work, we knew a lot, even back in the early 1900s, how social conditions could impact health. And even in the settlement houses themselves, they had to deal with a lot of diseases and illness through communicable diseases as well. And so, if you again trace the history of social work, you will find that a lot of the efforts at the time dealt with social services, but also directly impacted public health. Another example in 1890 is the Hull House with Jane Ann Addams and her plight to understand conditions of poor neighborhood, which again speaks to what we know today as social determinants of health. Julia Lathrop also headed the Children's Bureau in 1912, which was the first woman to head the agency. And this is a video, and you have the original PowerPoint presentation in the folder to view the video. In the essence of time, I want to move forward. I don't want this video to be too long for you to watch. But other examples of public health efforts in which social workers played a role is the 1938 National Foundation for Infantile Paralysis, or as we know today, the March of Dimes, the Salk vaccine, which was licensed in 1955 to treat polio. And in 1958, the March of Dimes developed a new mission to address birth defects. In short, the mission of the March of Dimes was to address infant paralysis. And through the work, policy work, macro work, research funding, um, donations of a dime actually over time um, resulted in the vaccine to help uh, address infantile paralysis or treat infantile paralysis. But since the March of Dimes was developed to treat that issue, that public health issue at the time, and it was treated, they had to focus their eyes or their vision and mission on another public health issue, and that's where we got the birth. It focused more on birth defects, but now today it does focus on that, but more so on prematurity. History of public health, social work. Public health social worker has its roots in maternal and child health. As someone who has a practice history and research interest in maternal child health, this excites me a lot. And to know that I work for most of my career in an area which is maternal and child health that has a strong root specifically and origins in social work is good to know. Um, Also, there has been expanded areas after maternal child health that public health social work has focused on. Examples include tobacco, obesity, influenza, human trafficking, and disaster preparedness. I'm trying to get the screen to forward. Apologize for that delay. The screen wouldn't advance. But public health shares social work issues. Public health and social work share similar challenges and issues. And hopefully, when I give you examples of these other public health challenges in social work, you really get to understand the connection. Domestic violence is considered a public health issue. Child abuse is considered a public health issue, and so is sexual assault. And these are three areas that you find a lot of social work involvement in intervention, in research, and in policy. Public health and social work focuses also on health promotion, protection from environmental harms, and disease prevention. So again, public health and social work focus on health promotion as well. And public health social work also targets populations rather than individuals. So there are a lot of public health social workers out there, and we can look at it from a broad level, which is macro public health social work. But there are also a lot of frontline direct practice social workers who are more working on the micro level to work on with individuals and families related to public health issues. But again, when you think about public health broadly and on a macro level, as this course does, we do look at public issues in a meso and in a macro um, context. So again, domestic violence, child abuse, and sexual assault are considered public health challenges and public health issues. When you're thinking about public health social worker, think about macro level health promotion, agencies, programs, legislation, policies that deal with health promotion, environmental protection, as well as disease prevention. And also, when you think of public health social work, think about macro interventions that help target populations rather than individuals. Here you're looking at macro interventions, macro assessments, macro policy development in social work. Healthy People 2020 goals include access to health services, adolescent health, specifically focus on adolescent health, early and middle childhood um, populations, education and community-based programs, environmental health, and family planning. Please familiarize yourself in more detail with the Healthy People 2020 goals. Also, we also have the grand challenges of social work. So when we think about from a public health standpoint, what are our goals? The Healthy People 2020 goals give you a good idea of where we're trying to head in terms of public health. And for social work specifically, the grand challenges of social work. This video talks about the grand challenges, and in the grand challenges specifically identifies areas of health promotion. Again, you have the hard copy of this PowerPoint, and you can click on that video um, this week as your course content. And when we think about social work values, we're looking at elimination of health disparities, and these are social work values that are specific or aligned with public health. Promotion of social, economic, and environmental justice, because we know that social determinants of health does play a role in overall health. And health disparities, when we think about it, includes race, ethnicity, gender identification, socioeconomic status, education, employment, insurance status, disability status, and geography. We also have public health and healthcare values as well. The NASW Code of Ethics, we have a revised version 2017. You should be able to click on that link and it should take it to you. I believe I have a copy of the Code of Ethics in one of the folders. If not, I'll make sure there's one uploaded for you. And I also like to take time to do this reflection piece. This is a personal value worksheet exercise. And I would like for you to do that personal value worksheet because it helps you understand what your personal values are. How many of your personal values are consistent or aligned with the NASW Code of Ethics, and that's good. But you also need to know where your personal values um, deviate from our code of ethics. And that's part of self-awareness as a social worker. And the reason that is important is that when you're working professionally, you have to make sure that the values and codes of our profession is what you're applying to your work with clients, and to understand it when it's your personal values versus our social work values that are at play in your work with clients. So if you have time this week, one of the reflective um, exercises that I would like for you to do is to do a personal value worksheet exercise, and you can click on that link for that. And that will help you start the foundation as you do your work and write your papers for this course. When you're thinking about your discussion boards, consider your personal values and particularly the NASW Code of Ethics and how they're aligned. That's the self-reflection that I want you to do in this class, and the skill that I want you to develop for your work as a social worker. Also, as you're talking or as you're learning more about the public health issues and the policies and interventions put in place for them, I want you to see how those policies and the development of those policies align with NASW social work values and ethics, and as well as how they align with your own as well. Another exercise I would like for you to do before COVID-19, we've had many public health scares in the United States. And one area particularly is Flint, Michigan. This is an article, a news article on how tap water became toxic in Flint, Michigan. And when you read that article, an exercise I want you to also do this week is reflect on what are the violated social work and public health values. When you think about values of public health and values of social work and the function of public health, how is that a contradiction based on the case study for Flint, Michigan? What social work skills do you think are needed at the meso and macro level to address the issue presented in Flint, Michigan? What are the public health social work tools you would consider? What prevention components is applicable to this case study? Think primary, tertiary, secondary, tertiary, primary, secondary, tertiary, and how would you address this issue at all levels of practice? But please be mindful more so on your meso macro, but also because we're social workers and we just don't practice in macro and meso, we are oftentimes asked to understand problems and issues, public health problems and issues from a micro, meso, and macro. I want you to consider them both. But specifically for this class, more emphasis and focus on the meso and the macro level. This will help you get a better understanding of the concepts that you're supposed to learn this week when it comes to epidemiology and public health functions, social work values, and the connection between public health and social work. When you think about public health and social work and the social work skills needed, think about community assessment. If many of you are taking social work practice and process, which I teach that as well, think about your community assessment assignment. You know, what are the community observation? What are the public health? What are the census and data information for that particular community? Think about gender, race, income, socioeconomic status. You know, what are some of the, how do you get to know and understand on a community, and how do you use a community assessment to understand a community? This is helpful when you're thinking about a public health condition or public health issue. When you think about COVID-19, think about the pandemic of COVID-19, but understand how it's going to impact each individual community. And by doing a community assessment, will help you understand how a particular pandemic, how COVID can impact a given community. Also think about social work values, you know, the values of the profession, and how do we use those values to address public health issues? How do we, as social workers, how social workers focus on vulnerable populations and the impacts of public health issues on those vulnerable populations? Again, think about COVID-19 and the deaths that occurred in nursing homes, for example. Cultural competence, what does cultural competence look like? What type of skills and understanding of cultural competence the social workers need to have to deal with public health issues, and specifically COVID-19, and having a special sensitivity to race and ethnicity. And for COVID-19, there will have to be special sensitivity to vulnerable populations, health populations, and people with pre-existing health conditions. So again, when you think about the social work skills that you want to apply in public health, all these come into play. And again, community assessment is key in understanding how a public health problem will impact a particular community. And again, I do know that some of you have already had some introduction to community assessments in your earlier methods course, particularly social work practice and process. If you want to refresh your knowledge of that in your Korstashman and Holes textbook, please do so. Other tools are community assessments, surveys, health impact assessments to determine the strength and weakness of a defined community, the resources in a community, who are key informants or key resources in that community, key data metrics for communities. You also want to understand social epidemiology studies, the impact of social factors on the distribution of health and illness in population, particularly related to culture. Um, Geographic information systems. This is again some part of your community assessments as well, where you're understanding and gathering data. Think about data management softwares that can conduct spatial analysis of distribution, trends, services, clusters, and maps of information, eco maps. All things that we use as social workers to understand communities better, understand the data that we gather from those communities and how to use that gather to inform our assessments and be able to develop policy to help keep people healthy and safe. Levels of practice, I mentioned it already through this presentation: micro, meso, macro. Micro, looking at the individual, sometimes families. Meso can be families as well, neighborhoods. Macro, you're looking at states, government, and so forth. So we're thinking about public health, but we want to look at it across the spectrum as social workers. Again, for this class, we're looking at it specifically in meso and macro. Social work, healthcare, part 2 is looking at it more from a micro. Meso, social work and healthcare 2 is looking at it more from micro, meso, and this class, social work and healthcare 1, is looking at it more from meso, macro. That concludes this video for this PowerPoint. Please look forward to additional videos for this course in subsequent weeks. Thank you.